Well, I think the advent of these novel targeted therapeutic options really offers the possibility that for those older, elderly, frail, more unfit patients, that there are new strategies available aside from hypomethylating agents and aside from standard intensive therapy. So the big news at the conference this year is the data being presented on venetoclax, the BCL2 inhibitor, sort of studies showing that venetoclax, although it does have limited single agent therapy responses, leads to very, very high response rates, 60, 70% in combination with low-dose chemotherapy, either low-dose cytarabine or low-dose azacitidine for the treatment of upfront elderly, frail patients. So does this mean that there's no longer a role for intensive chemotherapy? It doesn't, but it does offer the possibility that patients can take medications as an outpatient that for the first time are starting to approach the response rates that we've seen with intensive chemotherapy. The other excitement is that there's some hint that maybe the venetoclax is working through sort of a novel mechanism targeting leukemic stem cells, which we've thought hypothetically or scientifically has been a rationale for several years, but really haven't had a leukemic stem cell targeted therapy up until now. The development of IDH1 and IDH2 inhibitors, there's data presented on IDH2 inhibitors in the upfront setting for newly diagnosed frail patients. There's data emerging on the efficacy of IDH1 inhibitors. So again, although those are a smaller molecular subset of AML, again offering low-dose, non-toxic, low-intensity options for our AML patients. And because those patients make up about half of the individuals that we see newly diagnosed with AML, I think that opens a wealth of possibilities in terms of the options we're going to have available in the next few years.